Welcome to TCCC-Plus Day 2, Module 12, Infection and Antibiotics. This module covers infection prevention, recognition, and sustained antibiotic therapy. Infection shows up later than the initial massive bleeds, but prevention still happens already on day 1. In prolonged care, wound infection is the casualty's main risk after the bleeding stops, and it is the one place where a layperson's well-meant improvisation can do real downstream harm. Contaminated wounds, delayed surgery, environmental exposure, chest injuries that risk pneumonia. The risk climbs the longer you hold a casualty. Doing a good job cleaning and avoiding infection can prevent harm later, especially related to drug-resistant bacteria. Soil and debris, clothing fibers, metal fragments, none of these are sterile. Add to that your unclean hands and dirty dressings in a field setting. It is no wonder combat wounds get infected. However, the risk and severity can be reduced by simple means. For instance, an American study found that the risk of infection rose with each point of care the casualty passed through, but fell when proper hand hygiene measures were implemented, showing that handling the casualty, especially without proper hand hygiene, increases the risk of infection. Particularly high-risk wounds include open fractures, which we discussed on day 1. Any fracture with break in the skin is considered open. Deep penetrating wounds, blast injuries, heavily contaminated wounds, and any delayed evacuation. A large part of prevention of wound infection lies in proper wound care, and this doesn't need to be very complicated. What should be necessary at an ASM level is to clean and rinse wounds, prevent contamination, protect tissue, keep dressings clean, monitor, and avoid unnecessary handling. We will repeat this in the wound care section, but try to treat early with wound care. Rinse with clean water, remove debris, do not scrub or explore, cover with a clean, dry dressing, and give antibiotics for every high-risk open combat wound. Keep it oral and use what you have. Moxifloxacin 400 mg once daily, or cefadroxil 1 gram once daily, or cephalexin 500 mg every 6 hours. Continue for 7 to 10 days or until surgical care. Moxifloxacin comes from the older guidelines and remains an acceptable alternative. The current TCCC preference is cefadroxil or cephalexin, but the choice on the ground is an availability decision. And the rule that matters most over time: the full dose, the full course. Note that antibiotics at the point of injury buy time. They do not replace the surgical washout and debridement the wound will still need, but underdosing to stretch your supplies is exactly how you breed the resistant bug that takes the limb 3 weeks from now. Monitoring for infection can be both local and systemic. When we watch for local infection, we look for increasing pain, redness, swelling, local warmth, a foul smell, and pus. When we monitor for severe systemic infection, we look for systemic signs and symptoms. These may include fever and chills, weakness, confusion, fast breathing, fast pulse, cold, clammy skin. Those last ones indicate septic shock, and it means the infection has become life-threatening. In general, infections from wounds move from local to systemic, allowing us to catch them early before they cause serious trouble. Local wound signs first, then fever and chills, then the shock picture as it goes systemic. Try to prevent it by wound care, recognize it early, and keep it contained with antibiotics and wound care. So when we repeat the 5 times and 5 questions for infection and antibiotics, we want to look for what changed to catch the wound infection early. New redness, spreading redness or discoloring, a casualty going off, increasing pain, and so on. Let's recap. Infection develops over time. Keep wounds clean and covered, give antibiotics to every high-risk penetrating wound, give the full course, do not overhandle, and reassess. Thanks for watching Module 12 of the TCCC-Plus course, Day 2, Infections and Antibiotics. Next up is Module 13, Wound Care and Burns.